Okay, good evening. Welcome to our November 24th called emergency meeting. And this meeting was called because we've had 3 board members request that we have a meeting in response to the Cabarrus Health Alliance to review some data and to review the recommendation from the Cabarrus Health Alliance that Cabarrus County Schools moves to Plan C, which is all virtual learning due to substantial community spread in our community is experiencing. Again, if action is needed, we wanted to be able to do that before the students returned after Thanksgiving break. So I'd like to call the meeting to order. And I do want to say that we have all board members in attendance except David Harrison, which is on the line with us on the phone. And we also have our teacher Representative Emily Wagner and our board intern Finley Edwards on the line. So with that, we have an agenda that we need to adopt, which is really the only one item. So with that, I need a motion and a second to adopt our agenda.
So moved.
Okay, we have a motion by Mr. Harrison, second by Ms. Grimsley. All in favor of adopting our agenda tonight, please say aye. Aye. Anybody opposed?
Aye.
Okay, that motion passes 7-0. We've set our agenda. So how about we start with going through the current COVID numbers and the presentation from the Health Alliance. And we do have that presentation, I guess, is that on board docs? Can we bring that up? And since our Health Alliance representative is not on the line with us, do we want to just go through those slides, we discuss them, or how do we want to handle that?
I think the matrix was especially good information.
All right, let's go through the slides briefly. All board members have seen this before, so next slide. So I guess that shows where the current numbers are. I can't even read what the number is, but that was as of last Friday. Next slide. That was the breakdown. Is it? Okay, next slide. Okay, Ms. Carpenter, you wanted to comment on this one?
Yeah. One of the things I think that was very interesting on that, and you see it circled there, it showed when we started school, and you'll see that age bracket down there. It shows that had been kind of lower, and the age bracket shows the age groups that are school age. It had been lower, but when we started school, you can see how that jumped up. See the graph there? They circle that. And that's when we started school. And you see how that went up after we started school. And that's those dates. And that is the age bracket from, and that's what she stated. And that's after we started school. And that's in both of the categories and she told us what those age groups were. That's what is that, a bluish green and the yellow, and then also the red. And all those groups increased after we started school. And they had been kind of, steady, not that increase, but it started after we started school. And everybody says, oh, but it doesn't spread after we start school. But again, and I'll ask the other question after, with the numbers.
Yeah, I mean, it's hard to tell. There's no numbers there on what's associated with each of those colors. And it looks like all the other ones are increasing as well. But
yeah, Mr. Chairman, I
yes.
just wanted to note that when we each went to our Health Alliance meeting, they also noted the red increase, which is the 25 to 49 age group. The Health Alliance believed that was in large part due to the parents of the school-age children. And maybe they're out and about doing more activities and whatnot now. So not to mention maybe social activities. But that was a big jump in the 25 to 49 range.
Okay. Anybody else with comments on this slide before we move to the next one? Okay, let's move to the next one. And that, I guess, is the positivity rate, which is what, 9.4? That hasn't been updated this week, has it? That was as of last Friday?
It gets updated usually on Wednesday for the week, so that'll be out tomorrow.
Okay. Anybody, I guess that's the highest it's been, is that, well, up and through the summer. Okay, next. So this was a chart of hospitalizations, and that was total hospitalizations in our local hospital, or is that just the local
Just
Cabarrus County residents?
Just Cabarrus residents. But
I can't
this one,
read.
if I remember correctly, it's up to 54, 58 now. This one went up a lot since this slide was captured.
Okay, so it's higher. than-
Currently, it's at 57.
Okay, and that's an indication of how our hospital, it doesn't really say what the capacity is, but.
And I just want to ask a quick question. So that's 57 of Cabarrus County residents or total? Cabarrus County, okay.
Yeah, they told us on the call with the Health Alliance, you guys tell me if I'm wrong, that they were changing that now, so they're not taking people from outside, isn't that what they said? So I think those are all Cabarrus County residents according to the call.
Any other comments on the slide? Okay, let's move to the next one. So this, and unfortunately I can't really read it, but it's essentially the recommendation from the Health Alliance based on the,
I'm happy to
Oh,
comment
please.
on it. I have it pulled up so I can
okay,
see a little better here. The Health Alliance shared this matrix, which, Dr. Lotta, do you remember, this came down from the state as well, I think, or they just created it here?
Yeah, they were working on this, and then the governor group came out with kind of a similar type thing, but they were working on this because they were getting asked by lots of people what their recommendation were. So they were working on this and came out with it essentially right after the governor did, but it's different than the one the governor did.
Okay. So if you follow across the top, it has the zone, and currently, and I didn't look today, but I'll say as of 2 days ago, we were in the orange zone, on the high end of the orange zone on the state map. They have 2 or 3 metrics on there that they are using as reference points, and then what they recommend for municipalities, businesses, and schools. So right now, we're in the, or I shouldn't say right now, because we may be updating tomorrow is what I expect, based on what they were seeing, their trends of over 100 new cases per day, just in the county. But if you look at the orange zone, it was 19 to 24 cases per day per 100,000 people tracked over previous 14-day period, the 40 to 52 cases per day in Cabarrus County, and the 547 to 728 new cases in 14 days. The metric 2% positive was 8% to 10%, and the metric 3 hospitalizations atrium Cabarrus. As of the time when we each met with the Health Alliance last week over a couple days, we were already far exceeding metric 1 for the orange zone, and we were at metric 3 in the orange zone. The only one we hadn't gone over was metric 2, but we were teetering at the 10%. So you can see the note there for businesses: require teleworking and virtual meetings for non-essential staff, limited interaction, provide services virtually as much as possible. And they say in schools, plan B or C. In the red zone, which we believe we've now fully entered, the 25 cases per day per 100,000 tracked over 14 days, 53 cases and over per day in Cabarrus County. I believe they said they were at about 104 new cases when I attended the meeting last week. And they had several days already where they were over 100 cases per day increase. The metric of 10% and above, again, when we saw this slide for the first time, we were at 9.4, was it? 9.8? I don't remember. So we were already, that's the only metric we had not met for the red zone. And the hospitalizations, they were already looking at using other areas in the hospital than what they were using currently. So that's where they start recommending essential employees only in facilities, limited services on site, and limited indoor dining, takeout delivery only. And that's kind of where the governor started coming out saying, make sure we're limiting, wear a mask, even if you're with anyone who's not from your household, and schools in Plan C. So that's kind of the essence of the information all of us gained last week, and then watching the numbers ourselves.
okay, thank you for going over that chart with us. Anyone else have anything to add on this chart? And then, do we have the most current numbers?
Current numbers of,
The metrics, cases, I think we've kind of gone over a lot of that, but cases, those metrics.
The positivity rate, they update as a week, so you don't have you may have one day with a really high positivity rate, and the next day it may be low, so they usually report it as a week, so you get a much better sense of what it's really like instead of just one bad day or one good day. So that comes out on Wednesday, but everything else is a daily report.
so I just want to go over my numbers that I've got, that you sent out today in response to my questions. I'm assuming this is where we are on 11/23. So it says that there are 6,248 total confirmed cases, 5,193 have recovered. That's what came out today.
That's on the Health Alliance's reported, but now that's the amount of cases since the beginning of the pandemic, and then you asked for how many people are not recovered, and so that's the number of that they're reporting is not recovered at this point.
Okay, but if we're talking numbers, then also the response was the latest updated numbers of Cabarrus County schools for positives, and it's 97 students and 40 staff.
Now, that's how many there were since we started school. So there may be a positive, for example, in the first week that we started school, somebody was positive. Well, they're not positive anymore, but they were on October 17th. So you asked for the total amount of people that were positive, students and staff, and so we gave you that number. But
like, what is that time frame?
that's since we started school, which
So,
was
but most of
October
those
17th.
people that were positive really come off of quarantine. This is what I was asking last time. So if we've had positives, they probably are no longer positive in that length of time. They're not even in quarantine. So how do we get the number? You know, like you send that pretty much out to us that says X number of students at this school, X number of staff. What did we, to me, it's really important, what do we have like now? Like how many positives do we have now? Not before on October 7th, because they're not going to be
Right,
probably.
we're not tracking them when they become not positive because they're not reporting that to us
So
necessarily.
this is an accumulative to know that
Yes.
from day one of October 17th, we've had 97 students and 40 staff total
Through
since then.
yesterday, not counting today.
Okay.
Didn't the health department say 14 days is what they consider a period of COVID? And then it's not-
You know, this is all can be so confusing, because my thought is, how do you keep up with who we actually have positive now? You know, and the reason I'm asking that is because it's going to lead into my next question, and we can either go there now or we can do it later. But if we are going to have positive cases, then we know we're doing contact tracing. We know that affects the people that are being quarantined, whether it's other students, other staff, other people. But how do we know what's going on now? Because the majority of those people will probably, it's no longer an impact, if you will. So is that number evidently less now? We've got the less numbers positive? I guess is where I'm going with that.
Well, as we said, so that's a fluid number. So
I know, it is, but
people
that's
are-
important. It's so important.
Well, it's not necessarily information that we're going to get. So if somebody, they're not going to call and report. If we know that somebody's positive, then they have to follow the Health Alliance and their medical providers' guidance. So somebody could be positive, have no symptoms, and 14 days later be fine to come back. Somebody else may end up in the hospital for 3 weeks and still have that. So all of that moves. And as soon as 2 may be okay today, then we also had new cases today of people that are positive. So that number changes all the time.
So that is the hard part of this, because if we're basing a big decision on how many positives that we have and how that's affecting all the schools, how do you make that number accurate? I want to know if we've had, to me, since October the 7th, if we've had 97 cases of students, probably the majority of those, it no longer means anything. They're fine, everybody's good, we're moving on. How many do we have today or yesterday that would be now? The reason why you have to worry about that is because of how many of the people they've impacted to quarantine, which is my next question is, are we, and I'm sure you are, I don't think we've gotten it, but how many people are quarantining? Like, what impact does that have on our staffing? Are we getting short-staffed in teachers? You know, I hear that that's the overall big picture, is how many students or teachers are being impacted. If they're having to quarantine, they're no longer able to be in the classroom. That is a bigger picture to me. You know, are we headed towards having staffing issues? I don't think we've even gotten that information.
You're not going to get that information because that's going to be 43 different schools' information is tracking that. So the principal is tracking it at each place, but they're not reporting that centrally necessarily and keeping a running tally of that because it would take tons and tons of manpower, to be quite honest. So,
And I get that, but what do we do? I mean, we just figure out that teachers don't show up and we have to get subs and maybe that works, maybe that doesn't. I mean, that to me is the bigger piece of it because we can't say 97 teachers or staff have tested positive, so we know that that's already impacted a quarantine issue. But did it impact the teacher in the classroom?
it just depends. So you may have a positive case at a school. One positive may have, 2 people who have to quarantine that aren't positive, but they have to quarantine, or you might have 10 people that have to quarantine.
Right.
And so the principal has to know, well, I have one positive person. These people, per the Health Alliance, have to quarantine. Therefore, the principal has to figure out how they're going to cover that, because sometimes the quarantine is a 2-day quarantine, depending on what they know. It can be 7 days, can be 14 days, can be 28 days, depending on the circumstances. And sometimes quarantine doesn't have anything to do with us. So, for example, a teacher's child has been exposed at their daycare. Therefore, their child has to quarantine. Therefore, the teacher has to stay home with their child for 14 days. Therefore, a principal has an opening for 14 days. But that's not information that is going to be reported to us in specifics to be able to keep up with. So all of that information is information that the principal has to know to cover, but it's not necessarily information that we're privy to, because it's not necessarily our employees that are under the quarantine, but it may be somebody in their family.
But if the teacher is home being quarantined, it does impact us.
That's right, and the principal has to cover just like they would if we weren't in COVID, which is when there's a problem, the principal has to get a sub, figure out how to cover the class, just like they've always had to do.
So how do we know until we're like in really, or are we, do you see that we're having issues with covering teachers that have to be out for those reasons?
Yeah, it depends on the school. As we said, you may have one person who's out today, you may have 7 people that are out today, and you won't know that until, again, teacher calls into the principal and says, I'm going to be out, my child is under quarantine, or my husband was positive, therefore I have to quarantine. So while there are no positives there, it definitely affects the school, and that's why the impact of community spread absolutely comes to the school, because what else going out there may make someone quarantine, and then they have to cover the classroom.
And I'm really not trying to be obstinate about this, but what I'm saying is, so just like in my job, if I have 4 crews and I know that one of them is positive, or there's another one in their family that's positive, and we really have to kind of take all the guys out that they have come in contact with, because you don't know yet, and they're going to quarantine. I know I'm short a whole crew. I know I have to do a backup crew, which is our subs. So I need to know, are we at a critical state or going that way, that we don't have enough teacher coverages, that there's enough out, or is it starting to look into a cycle that we are going to have problems with staffing, that there is going to be a problem with having teachers in the classroom?
Would I say that we're at a critical state now? No. But is there more of that today than there was 2 weeks ago, which is more than there was 2 weeks before that? Absolutely.
Sure. Okay. Because I was thinking, okay, if that number 97 is from day one, okay, those people have quarantined, done what they need to do, and they're back. Maybe, right. But how do we know that? That's the picture I would like to have seen. If it's 97, are those active and they're all quarantined or out, and we're having to have subs come in? Or is 97 the number that it was, and now we're down to 50 and 47 have returned?
That's never going to be a number that's going to be accurate, because, again, it sometimes is reliant on people who are outside of our organization that determine that, and they're not obligated to necessarily give us that information. So the principal and the Health Alliance know Mr. So-and-so has to quarantine for 14 days, and they're managing that. But that's again, if that's going to get reported up and we have to track that across 43 organizations, then it's going to take staff to do that.
But
And
how would our human resources department not know that? I mean, how do we cover if we don't know that?
they do at the time, they're working with to know it at the time, but they're not keeping that and then saying, oh, you call me back tomorrow whenever you're not positive or when you get a clearance by a doctor, because again, it takes tremendous staff to be able to handle that. So one principal is going to know it, but you can't have one centralized person that's doing that for 43 organizations. One person can't do it.
So when we started all this back in the very beginning, the Health Alliance came on record and said that if we wound up having issues with contact tracing and or anything with the school system, that they would help provide support staff. Have we ever asked for that or received any?
They're doing it all the time. Our human resources, Mr. Schultz with human resources employees, Mr. Schultz with students, and probably 6 different people at the Health Alliance do it from literally 5 o'clock in the morning till 10 o'clock at night. They're getting reports of this person's positive, this person has to quarantine, how do we handle it, what's the judgment of whether or not they have to quarantine, and then you start over with more the next day. And sometimes they may work 6 hours on one, and then it turns out, you know what, they're not positive. So you spend all day working on one that thought they had to quarantine, doesn't have to quarantine, and then you move on to the next one.
Yeah, and if I might add just an example, Holly, from principals managing their campuses. We've had some emails, so I won't say it's scientific data, but in reading the emails, teachers at one school, or maybe multiple schools, because I don't remember where everybody works, but reported that they help to cover. If they can't get subs, they tell the principal, I'll give up my planning period, and I'll help cover. So you have high school classes. A teacher has to be quarantined, is already sick, whatever the situation. They have 3 classes in one planning period. So 3 other teachers give up their planning, but the principal's managing all that. They're not necessarily reporting it.
I get that, but that would be for a day. What are we doing when they're quarantined for?
No, that's like
Multiple
for 2
days.
weeks they're doing that.
Okay, but they can't do it for everybody. I mean, if all of a
Yeah.
sudden, if you've just got 1 or 2, that's one thing, but if you've got 3 or 4, and now that's titrated out to 3 or 4 more people, that number gets larger.
Right.
It becomes a staffing issue that they
Yeah.
can't handle in-house.
No, and I had asked Mrs. Jones after, and you can correct me, Dr. Loud, if this is wrong, whatever, but after last meeting, we were talking about subs, and she said it's hard. A lot of them are retirees, and so therefore don't want to sub right now, and so the sub pool was way down. So I don't know that we're at a critical mass, but if principals are having teachers cover in their planning periods, then that's because they can't get subs. Then I would say it's converging.
But that's where I'm going.
Yeah.
Where are we headed with that?
Again, they have to do that all the time, and they are now, where TAs are covering, they're having other teachers cover, some subs if they can get them, or they're regular. So, every year covering classes is a problem. Is that more of an issue now because of this and contact tracing? Yes. And so again, it may be today or for this last week, I had 2 people out, so it wasn't a problem. Well, then all of a sudden, 4 people are positive and 6 have to quarantine. Now I have 12, and now I've got more of a problem. I got to figure that out, and principals are doing that every day. So it's definitely a struggle and more of a struggle. Again, would I describe that today as critical that we can't operate? No, but yes, it becomes more of a problem every day.
All right, thank you.
Laura?
I have a
Hold on,
question.
let Ms. Blackwell, and then Ms. Carpenter.
Okay, so you had mentioned that Cabarrus Health Alliance is not obligated to give us that information for the questions that Holly was asking. I guess I'm a little confused by that. I don't know why they wouldn't be obligated to give us that information when they are providing us with this information and telling us, based on these metrics and this plan, what we should decide to do for the school system. So I do feel like they should be obligated to give us this information regarding the schools.
What I was really talking about was the person who is under quarantine is not necessarily obligated to give us that information. The Health Alliance will share any information that they can legally share with us and do all the time. But just give you an example back from what we were saying, we're sometimes doing contact tracing on an employee that literally may take 5 hours where they're calling back, they're getting their result. Well, then they live in Mecklenburg County, but they work in Cabarrus County. We don't get information from the Mecklenburg County Health Department. So tracking that information, tracing that information, if we get it,
difficult.
if we get it at all, it may be 30 days late. So 30 days late doesn't help you with contact tracing.
Right, and so it may not even be accurate.
That's right. And
most
so
of the time.
but an employee is not necessarily obligated to share their husband's information, their child's information, if they work or live in another, well, not if they work, if they live in another county. So yes, a lot of times it's pretty simple and it's easily shared information. Other times it becomes exceedingly complicated and not necessarily quick information. So it just depends. But the Health Alliance, again, Brian, Mr. Schultz, Ms. Jones, and members of their staff, myself, Mr. Tyson, we're talking to the Health Alliance, 12, 15, 25 times a day, literally. All of them are sharing that, depending on the situation, the contact tracing, and trying to track that information down to confirm it. So we have employees that say, I'm positive for COVID, and then we check with the Health Alliance, and it turns out that they're incorrect. So we spent 3 hours tracing that, and it turns out they misread their results, so they think they have COVID-19. They actually don't. So all that information is work, around the clock. And so our Health Alliance is working with us to confirm that and, make the best decision that we can with the information that we have.
So, and I asked this at the last meeting, and I just want confirmation of this again. How many of these during contact tracing have been traced back to getting this at school?
Yeah, today we do not have any that they got they got the virus at school. We don't have any of those. Now, again, that could have changed this morning, and doesn't mean that we can't have it tomorrow, but as of now, there's nobody that we're aware of who got it at school.
Does the CDC recommend that kids stay in school?
I can't tell you exactly. I think what I've seen is that the CDC has lost a whole lot of credibility for all kinds of strange political reasons, and so I think you can go back 6 months and say the CDC said 5 different things 5 different times, and that depends on if a senator's got involved, the president's got involved, if they've done it. So honestly, I can't tell you exactly what the CDC has said or has changed or modified since we started.
Okay, so, and I have one more question. I know, and I have experienced this personally, along with a lot of other parents and students that are in the same boat. We have so many kids that have grades that they have never had before, and they're going in the wrong direction, and I'm talking Fs. So have you had conversations with teachers and principals about how these children are actually doing with their report cards, progress reports, since we started going virtual?
Yeah, so that's definitely something that the curriculum department looks at. Just ran the first quarter, we just finished the first quarter not too long ago to run grades and, talk about that with principals of, is there an issue at this school versus that school? So yes, they're looking at that and trying to, determine how best to handle that, and then obviously in a not perfect situation.
So have y'all noticed that grades are worse in particular grade levels, or?
Yeah, I know in
particular
some of
schools?
the superintendent calls, regional and state calls, is that are there more Fs across the state now than there has been in the past at this point? I think the answer to that's yes.
Okay, thank you.
Ms. Carpenter?
Yeah, my question is, and again, it kind of goes back to what, can y'all hear me okay, or do I need to take my mask off? Again, about the numbers, because on the Health Alliance website, Holly had asked about a breakdown of the age groups. And on their website, they've got a scale, and it talks, and it says cases by age. And this was on 11/8 when the percentage rate was 9.4. And it states 0 to 1, and in the title it says cases by age, and it shows 0 to 1, it says 54, and then 2 to 4, it says 64. And then when you get to the age for our children, it's showing 5 to 9, it says 178. And then for 10 to 14, 235, 15 to 17, 220. Well, if you add 178, 235, and 220, that's a whole lot more than what we're getting. Now, why are these numbers so much different than what we're getting? Now, can anybody explain that?
We don't have our Health Alliance rep on the phones.
I mean, and like I say, the date of this was 11/8. Now, that's where I have a question, because, and then, you know, I've got the breakdown, like 18 to 24 is 18, and then as Ms. Furtenball had mentioned, for ages 25 to 49, they're showing 2,761. But that's the totals they're given for that date. And it does say cases by age.
Yeah, Caroline, I think you're probably looking at state numbers. If we go back to that graph.
No, this was Cabarrus County.
No?
Yeah, the Health Alliance has added to their site, you can pick up, they're picking it up from the state site currently if you go on their website, and it does show cases by age.
Well, and it may be the accumulation of all of those teal colors on the bottom that have been increasing.
This would probably be the total of what our cases are for that total cases we have.
Yeah, but I think it's probably those numbers accumulating is what it is across the bottom.
It would be like, our total cases are like
Yeah, Ms. Harrison, you're
6,000
next.
some cases.
Yeah, I think that's the
So-
chart is the reference.
I think that graph is from the beginning of the pandemic. But at the end of the day, that's why I asked for that number today, which we got 97, is what came out. So how do we have 97 cases, but those numbers show that, and even if they are from the beginning, that's a huge number compared to what you gave us up to date, that should be today's number.
What she's talking about on what's on here are the total cases in Cabarrus County. We're reporting to you confirmed positives from Cabarrus County schools, which is two different things.
I know, that's the most important piece of that, because that we are not, those numbers that she's looking at are not Cabarrus County school kids. Only 97 evidently, according to your numbers, are a piece of that, right?
That's correct. So 97 of the total that are listed here are actually students that have been to school. The other ones are students that, they may all be in C, for example. So if they've been in C and never come to school, then we're not reporting them at school because they obviously never attended school.
But what I'm asking, are they charter school kids? Are they
Could
kids
be.
that are homeschooled, kids that don't even have anything to do with our system?
That's right.
So this is where I have a problem. When we start putting stuff together to make this decision, which is huge, I mean, this is a big decision for these parents and for all of us, period. When I sit in on that phone call Friday morning, so I got to hear that the numbers are escalating at a huge rate. The ratio of positives are escalating at a huge rate, and that has put a big fear out there, and our emails are blowing up because of that fact. And it is serious information, and it's information that we need to take into consideration. But when we look at what piece do we play, and I said, you know, we're not the source for that. That is a number that encapsulates everybody, all the charter schools, private schools, homeschoolers, everybody. It is not Cabarrus County school kids. And that just confirms it today with that number that came out. There's only 97 of whatever number you just determined that, and that was only November the 8th, so today's date is 11/24, and we only have 97 cases. That's why I get really frustrated on how do we take this information, break it down into what is really Cabarrus County schools, which is our responsibility. We're not responsible for who shuts down in Cabarrus County. You know, we don't have a say in big box stores if they get closed or their restrictions get tighter. Ours is our responsibility. So out of all those numbers that we got presented Friday morning, only 97 of those cases as of today, and that was 11/8, are really truly Cabarrus County School students and only 40 staff. Is that correct? I mean, Chris, I need to know that. Is that actually true?
Yeah, just like I said, as of yesterday, the confirmed cases are the ones that we sent you today.
Which are 97 students and 40 staff.
That's correct.
And those are from the very beginning.
From October, 19th, the first day that we,
So those
17th.
are
whatever day
not
that was.
current active cases right
Well, some of
now.
them would be.
Some of them are.
Some of them, but not all.
That's right.
Okay.
Mr. Harrison?
No, let me just, let conversation continue, please.
Okay. Mr. Shoemaker?
So, Ms. Grimsley, we're here because you were alarmed at, I guess, some things that happened this weekend or the reports that we had on Friday, and you asked to have a special meeting, and
So
we
let
wanted
me
to do
clarify that,
Yes.
and I am going to stop you for just a moment.
I was just
No,
just saying
you're
you were
on-
alarmed, and
you're
I
on
just
task.
wanted to
Right.
confirm that. That's all I
So the
wanted to say.
reason why I was, alarmed might be a strong word, but the reason I agreed to have this call meeting is because we have so many different numbers coming in. When I listened to that Friday morning, that is a huge piece of information that I felt like we did not have. That, you're exactly right. But that's why I wanted to say I'm more than open-minded. I want to make sure our teachers and our staff are taken care of. I want to make sure we're not doing things that's going to get us into even more trouble, to get us in a critical situation that we don't have staff covering students' classes. I want to have those conversations. We need to have those conversations. We all get a lot of information every day. General public does not. They don't get to break it down into Cabarrus County schools. We do, and we see it, and today really broke it down. But that's why I was a little worried that we're hearing all these big numbers, but yet what piece of that is Cabarrus County schools? That was my problem with that. I really wanted to know what part do we play in it. So we are saying right there, we're not the source. We are not the source. And when I said that Friday morning, they confirmed we are not the source. We are doing a phenomenal job, and I'm pretty sure that others were on that. That was the word they used. We are doing a phenomenal job keeping our campuses safe. We are mandating masks. It's not an option. The social distancing, not an option. Everybody on our campuses are doing what they're supposed to do, and the Health Alliance confirmed that. Where we get into trouble is where everybody else is leaving and going to doing something totally different out in the community, which we don't control. We can't control what they do at home or where they go or how they expose themselves, family functions, Lowe's, Targets, Harris Teeter, wherever. Cindy, you referenced Harris Teeter. We can't control that. But we are doing a good job with our situation. So the question comes back to me personally, and that's where I was, and I was hearing that we were having a lot of problems with teachers and needing to cover and subs and the whole gamut that dominoes with all that. But I don't know. I don't know that for a fact. That's why we need, we have got to be able to find a way to, other than saying at the last minute, oh my gosh, we don't have half the teachers that we need to cover classes. That's why I wanted to have the conversation. So I guess at the end of the day, are we going to close the schools because we're looking at total Cabarrus County numbers, Cabarrus County as a whole, everybody, not just Cabarrus County schools, which looks different to me, and that's what I wanted clarified. So yeah, it did. I'm definitely open to having the conversation and being a part of that, but I want to make sure we make these right decisions for the right ways. Now, I'm sorry, you go ahead.
Thank you. Well, and so you don't. So we've come to this juncture where there is concern about the rising rates, and of course we know that the ratios have gone from 5%, which is 1 out of 20, to now almost 1 out of 10 in 5 weeks. So approximately 2 to 3 a week. Every week we've seen the increase for Cabarrus County, not for Cabarrus County schools. They've been impacted, but we don't know the true extent of that at this point. The health department shared with us, Cabarrus Health Alliance shared with us at the meeting on Friday and on Thursday night that they were concerned about the rapid rate of increase over 5 weeks, the fact that we increased over 5% in just in a 5-week time, and then Thanksgiving holidays coming up, their concern was that it would go higher, but they couldn't, all they had was the past data to support that argument. And up until yesterday, I said at the last meeting that I was going to leave it up to the new board. So, for us to meet here and make this decision tonight on possibly going back to a C, have you had conversations, and do you think that, I'm concerned about this board making decisions for the future and being impugned because we made a decision that wasn't popular with the 3 new coming board members and with the new board, thinking that we acted recklessly or overtly. I understand the increase, and I see the hockey stick formation that's in these geometric progressions, and obviously this chart here does demonstrate a rather rapid rate of increase. But, I was content up until we had the call meeting to wait until the new board came in and leave this for them to decide. So do you feel right now that we need to act and make a decision tonight?
So I think that's why we're all here, and I think we need a recommendation. That the issue that I really, truly have is, are we making the decision for the right reason? And I didn't want to wait until December. We can't, that meeting is December 7th. The business meeting is December the 14th. We can't wait until the last minute to inform these parents if we're going to make a change.
A recommendation from who? The Health Alliance gave us the recommendation, or?
No, I said, Barry's referencing us leaving it to the new board. Well, they don't even get installed until December the 17th. So if we take this up again, that gives parents no heads up whatsoever if it changes. If it doesn't change, great. But if it were to change, that's a huge thing. All of a sudden they're looking for daycare, which is minimal, and they're looking for other options. That's why I agreed to have the meeting. We need to make a decision if we are going to do anything different. What was concerning to me, and that's why I asked for the information, and I appreciate that, because what I was hearing Friday morning, we're on that call for that length of time, and you're getting all that information about all these escalations, but you really don't get to see where is Cabarrus County Schools in that. And that's the biggest piece for me. I get it, and I heard, well, that's going to tether over into Cabarrus County Schools because we're the largest employer. We've got 32,000 plus kids, going in, spending larger quantities of time during the day on the same campus, and I get all that. At the end of the day, we're still the safest place to be. I wanted to be able to hear all this escalation is not being tied back to our school campuses. And that wasn't an answer I got until today.
But we're here because in our conversation last night, you said you were convinced that we needed to go to the old Plan C.
Not
Are you
convinced. I said I was willing to entertain that because I
Well,
was
but
concerned
we
with
are
the
here,
information.
wait, let me finish. We're here because you rose the flag and said, let's convene, because I think we need to go to Plan C, and you've talked to a number of people, I think, to confirm that, this is the decision I believe I think we're going to make. But
No, you
none
and
of
I said we weren't sure.
I did not put any pressure on you to come back to this board.
Nobody put any
Nobody's put
pressure.
any. I want the public to understand, because we're getting impugned. They think that the three people that are leaving have called this meeting. That is not what happened.
I
want to be clear. We're here because there was concerns, and we had the same concerns, but we had said in the last Monday meeting that we were going to wait until the new board, even with these new revelations. We said, well, what do? We don't want to get in the middle of setting another board up to overturn and make a hasty decision on what we decided. So if the new board that comes in is not going to make that hasty decision, that helps talk about this conversation. But, I'm not going to make the motion tonight to go into anything. I'm going to wait for, I think you should make the motion as to what we do, because
I am more than happy to do that. Here's
Thank
where
you.
I am. I've spoke to every one of those new board members coming in. They all get it, that we have lots of issues going on in the county. I think what happens is we all get really caught up in these 2 and 3 hour phone conversations, all these hundreds of emails that come in. You know, for everyone that I got that, you know, y'all are making really bad decisions on this side, you're making really bad decisions on that side. They all come in. You can debate. I told somebody today, I think it was you, I could debate this on both sides and win every day, you know, because it's serious. You know, it's serious.
Yes,
It's
it
a
is.
huge, huge decision. I am all over the place sometimes with this. I really, truly am. I absolutely 100% advocate for keeping these kids in schools. I will never back down from that, ever. But when you're sitting there and you're on a 2-hour phone call that says, you know, it's horrible, the numbers are escalating at a rate that we weren't prepared for, we're not sure how things are going to go. Well, we do need to step back and take a picture. Is that really us? You know, you just made the comment. All of these numbers went up since we came into school. Okay, that probably is because they're all going to be exposed, but it's because they're being exposed somewhere else other than school. You know, so we have to recognize that. But is it enough? Because we've all of a sudden started having really issues with staff because everybody now is getting quarantined. You know, you may have not tested positive, but your spouse has tested positive or someone else has. So now we're having to have people stay home because they're in this quarantine list. I don't know how much of that is a problem with us. That's what I need to know. Are we really going into a
Right.
problem?
And the fear that the health department had was that coming out of the Thanksgiving holidays, that the escalation would continue. Now, that was the concern that they had because of the unbelievably rapid rates that they'd seen over the last 5 weeks. And the possibility exists that it could be as high as 1 out of 8 by the time the new board convenes, which is about 12% if you just follow the trajectory of the current timeline. The other concern that came out of the health department, and it's borne out by the fact that the hospital stays are up to 57 people, and they're all Cabarrus County people, is that the hospitals do not have the capacity to have any more because they've literally tapped out the staff, not the rooms, the staff, and able to take care of this disease. And that's what they were, again, witnessed to us on Thursday and Friday, is that they had some staff issues, and they were having to go to premium. And premium means, in most cases, some type of overtime because to help augment the need for additional staff to help the hospitalizations up. Is that all tied directly to schools? Yes and no. But what could happen, and I think this was their bigger fear, is that the schools would become the collateral damage. And eventually, just like with noroviruses and other things, enough would start getting it, and then it would proliferate, especially coming back from the Thanksgiving. So that was the context of the concern that we heard from our friends at Cabarrus Health Alliance, and that's, I think, the picture they were trying to paint for us. But at the same time, I understand the problem that it creates for the parents. Going from B was a middle ground, but going back to C is going to be tough because they'll have to find 6 days of coverage for their children in addition to what they already are covering. So they'll have to augment until Christmas with an additional 6 days, depending on how the motion goes and what length of time we decide that we think we need for quiet time to possibly reverse the trajectory of the progression that we see right now.
And I hear you, and that's why we're here tonight, because that's what I said. I don't want to wait till the last minute. I don't want to wait till the new board is installed. That's too late. You know, that's December the 7th and December the 14th. By the time we make a decision, they have nothing left. They're out of school for Christmas break the very next week. That's way too late, and I get that, you know, and I appreciate the fact that, you know, you thought it better for a lot of reasons to leave that to the new board, but the more I got to think about that, that gives parents 0 time to figure that out. So between now and then, they're on this, maybe we are, maybe we aren't, and that's just not good. What I really wanted to be able to hear is the recommendation from Dr. Lauder over where we really figure into that information that came out, because that was a lot of information Friday morning. You know, it encapsulated all of Cabarrus County. But then when I got to looking with the numbers that came out today, if we've only got 97 students positives, but that number that was showed to us Friday morning was what, over 300 in the 0 to 17? Yeah. So if you add up all those age groups for our elementary, middle, and high, that was a huge number, but yet that's not the number we get today. That's actual Cabarrus County schools. So that's you know, that just didn't work for me.
Okay,
Do you understand that?
Is there a question? Did you have a question for Dr. Lauder?
Yes, I would love to have a recommendation. That's what he and I spoke about.
Yeah, so I have to say, I met with the Health Alliance like I do twice a week. They expressed what they've said. We showed you up there, which was we're on the borderline of a chart. I set up for all of you board members to be able to talk to the Health Alliance, to ask them questions, and have any kind of questions that you may have. When we were done with that, board members expressed that they were not interested in making any kind of a change with where we were at in the performance. And I was told yesterday that Ms. Grimsley wants to call a board meeting to move to Plan C. And so that is why we're here. I'm here to answer any question that's available, but I was never asked for my recommendation, not prepared to make a recommendation, because my understanding is we are here because you want to go to Plan C. If that is not true, then I don't know why we're in the meeting tonight. I will be glad to try to answer anyone's question, but my understanding is you wanted to go to Plan C,
Well,
and
I
that
need
is
to
why we're
correct you
here.
on that.
Again, I was told that by several board members. That may be incorrect. If that's incorrect, then I'm not sure why we're here, to be quite
Well,
honest.
that's probably not correct. It was a discussion about going to Plan C. And yes, I did ask you for a recommendation. We have not met. in
No,
a
ma'am, that
meeting.
is not true. I have not
Well-
been asked for a recommendation.
So last week, we did not ask you for a recommendation during our meeting.
I have not been asked for a recommendation since.
I'm pretty sure you're on record last
No,
week.
ma'am, that is not true.
Well,
Are
I
you
guess
asking
we-
for a recommendation?
You asked
I
me
would
for a
like to,
recommendation last week.
I would like to know when I have been asked for a recommendation, because I
It
have
was
just
at
been
our
told
meeting
Right now.
last
that
week.
is not, what did you say?
Apparently, she's asking right now.
And I'm
Well,
saying
even
I
if
have
it
not
was-
been asked prior to tonight and was not asked to make a recommendation tonight. We are here
I didn't say
unless I have been
tonight.
told incorrectly, because Ms. Grimsley wanted to have a meeting to move to Plan C. Is that correct or
We
incorrect,
have
Mr.
two
Walter?
board members who requested an emergency
I started
meeting.
saying-
Who
I'm pretty sure I was
who
one third.
requested the emergency meeting?
Ms. Furtenbaugh and Ms. Grimsley.
Okay, and I was told
I
by
sent the request.
a majority of the board that Ms. Grimsley wants to move to Plan C. Is that what you were told?
I was under the understanding she is moving in that direction.
So is that my understanding from other board members, is that we're here because Ms. Grimsley wanted to move to Plan C?
Well, then let me clear that up. I can do that real quick.
Okay.
I said we need to discuss moving to Plan C, because that is what I was told we were put in those discussions with the Cabarrus Health Alliance this past Friday. Otherwise, why were we having those conversations Thursday and Friday after the meeting that we had on Monday night? You were asked for a recommendation Monday night, and you stated you didn't have one, and I'm pretty sure that could be pulled up. And I'm not saying that's
No,
a
this
bad thing.
board said at the end of the meeting that they did not want to make a decision because a new board was coming in, and everyone was happy about that.
But you made a statement to that as well. It had nothing to do with the board
We
members.
had new information from the Health Alliance. I made sure that all of the board had access to that information. When that was over, all indications were from you and other board members you did not want to make a change. And yesterday was told you wanted to make a change, and that's why we're here
So
tonight.
why were we asked to be a part of
There is a-
meetings on, Thursday and Friday? Why were we asked to participate in meetings or telephone conference calls with the Cabarrus Health Alliance if it was not to look at making a change?
So you would have all the information and have an opportunity to ask them any question that you wanted to, and that's why you guys were on for 90
They
minutes or
made-
so.
And
They-
you
they made
said
a
they were
recommendation.
recommending for us to move to Plan C.
They were presenting the information that was on the chart that we went over at the
But
beginning.
it came from you, Chris,
What came from me?
us having to be on those phone calls.
You didn't have to be on. It was an opportunity for you to be able to get information
I
and
get
ask
that.
questions.
But I got an email at whatever time that afternoon, Friday afternoon, after we had already been in a meeting that we all decided we weren't going to do anything else, and you said that the Health Alliance was wanting to recommend us to move to Plan C, that we needed to be on a telephone conference call either at 7:30, 8:15, or 8 or 9 o'clock the next morning.
I said the information is bad, moving in the wrong direction, which is there. The Health Alliance is going to make recommendations for schools and businesses, which you saw. We are at or on the borderline of that. So they are willing to meet with board members of Kannapolis City Schools and Cabarrus County Schools to see the
Why
information
would we have those
and have the
conversations?
opportunity to ask them questions. And you did
Okay.
that. And when that was over, you all said, we don't want to
No,
make
we
it.
did not make a decision because we didn't meet as a board after that. If there was conversations had after that, I was not privy to that.
Well, my understanding
actually was
was
out of
that
town
the
this
board
weekend.
still did not want to make a change after that information until
Well, I would
you
love to know who
indicated
you got
that
from,
yesterday.
because we don't make those decisions after telephone conference calls. We didn't get together and I guess, have a conversation. But I was asked how I felt about them, and I said, yes, I think we do probably need to have a meeting. The numbers are looking, the community was hearing that it's not good. They felt like it was in our school system. After we had that conversation this past Monday night, and we decided not to go there, you are so right, then we were presented with new information on either Thursday afternoon or Friday morning, and you said that the Health Alliance was recommending that we move into Plan C. I don't know how we go there unless we have a called meeting, because we can't act any other
Well,
way.
can we bring up the chart? Because it
Yeah.
does say on the top, Cabarrus Health Alliance recommendation.
And that is why we're here, is for
Yes.
this.
So it's not all about me asking for a
No,
special
the
call
Cabarrus,
meeting.
let me just get, at least in the Thursday night meeting, there was no recommendation by the Cabarrus Health Alliance that we move to Plan C.
Well, there was on Friday morning.
Just let me finish, because I'm speaking now.
All right.
There was no recommendation. They said that the rates have gone up alarmingly fast, and they showed us the chart and said that if you look at the chart, we're teetering on the red. Red means basically that you should go to Plan C, but they said we haven't met but 2 out of the 3 criteria to be in that. But you have to make a decision. We're not advocating one way or the other, but here's our concern. We're going into the holidays. We got 2 holidays back to back in less than 3 weeks, and we're going into an extended Thanksgiving holiday. And because the rates have been going up, literally doubled in 5 weeks, we expect them to continue to raise after the Thanksgiving holidays at this rapid rate. And that's what they wanted to address and make sure that we, as the elected officials, were understanding of what was going on. And the Kannapolis City Board of Education, they were members of that, were at the same meeting with us. With I think it was Cindy, Rob, and I. Rob, were you at that one?
At
The Thursday night one?
meeting,
Yeah. So we didn't have a quorum or anything, and all we did was listen to the information, and we got off the call. And that was the end of the call, so there was no decisions made. And we went through the weekend, and it wasn't until yesterday that the plea came out that we needed to have an emergency measure.
Well, where do you
meeting.
think that plea came from?
From you.
And where do you think I made that decision?
I don't know where you made that decision.
It's because we were all put in those telephone conference calls, and Carolyn, you
Right.
were on the one with me on Friday morning, and the recommendation was being pushed for us to look at
And
going to
it
Plan
does say
C.
recommendation right there on the screen. It is a
Yes,
recommendation.
I mean, we're having this conversations because we were asked to. We already had a board meeting this past Monday night. I feel like we
Bob,
are.
it doesn't say Plan C anywhere.
Yes, it does, on the bottom right.
Oh, yeah, in the bottom right, where? On the red?
Correct. They said
Yeah, well,
that-
that's what the CDC, and they said everybody says.
No, the
No, that's the
CDC
local
came out the
areas.
same
That's the
day.
Health Alliance.
Yes, this is the Health Alliance. This
So-
is what I'm talking about.
No,
Our
I did ask that question in our Thursday meeting because I told Ms. Conyers, I said, look, I said, what is this chart? I said, I've never seen this chart before. She said, this mimics exactly what the CDC has. It's been customized to our district, but the CDC has the exact same recommendations and the exact same colored chart. Those are her words.
I didn't hear the same, I didn't hear the same.
Well,
thing.
she said that.
And the
Cindy,
CDC
if you
came out
remember it,
Friday
please,
morning.
She
please
did
back me
reference
up.
that this was not just born out of the Health Alliance. This was something that
That's
they
correct.
put to include all the metrics.
But the confusing part is the CDC just came out Friday morning and made the statement that the most safest place for kids to be right now is in school. So that is why this was-
CDC did not address hotspots. In every conversation they've done publicly, at every coronavirus, they've never talked about hotspots. And then there was a person that followed Dr. Redfield right after that, said, yes, she was talking about children and especially exceptional children, and then she made a brief reference to unless your area is under some type of hotspot, but she didn't use the word hotspot, but under duress. But you've never heard them say in the coronavirus interviews that I've heard and watched, and I've watched a number of them, I've never heard them reference this. And this is the first time I've seen this. But when I asked Ms. Conyers about where did this come from, she said this is the general guidelines of the EDC, and it's been customized to our particular situation here in Cabarrus County. So that's why the numbers show Cabarrus County and Cabarrus County numbers. And she said each local area, each local health alliance is doing the same thing for their particular locale because the CDC doesn't know what's going on in their locale, what the numbers would look like, because you can see our numbers are more Cabarrus County centric. So that's what she discussed. Because I wanted to understand where this chart came from. And was it, I said, is this the chart is supported nationwide? What is this? And that's what she did. She came back and said, yes, the basis of this chart is a national level from the CDC, but it has been customized for Cabarrus County. So, yeah.
And I understand that, and that is, I'm getting the same reaction that I received Friday morning when Carolyn and I were both on there, and they did say they were pushing for us to move to Plan C, and I asked why, because I said, we are definitely not the source of what is going on that is the problem here. So my question and my statement to her was, if we even close the schools right now, according to our numbers, we are not going to have an impact on your numbers, be it good, be it bad. And she said, and that was my statement, that's what I wanted to discuss, and she said, not at this point, you're right, the schools have done a phenomenal job, that was her quote, in making sure that it's safe. There have not been any problems in the school system. You have very, very, very low numbers. This is her concern, but it is going to tether over into, because you're the largest employer in the county and you have 30,000 plus kids running around those campuses all day. So this is the conversation we were having. With that piece of it that I heard, yes, I agree that we probably need to have a conversation to discuss if we need to move into Plan C. I heard lots of negative stuff in there that I had not heard before. I was being very open-minded to have this discussion. But then when I got my information today, it appears that, number one, just like we've not pulled out of hospitalizations, are those any of our staff people? They're definitely not our students. Are they our staff people? Probably not. Are any of all of those numbers for that 0 to 17, they're all encapsulated. It's homeschoolers, it's private schools, it's charter schools, and it incorporates ours. But it was such a smaller number today, I was not prepared for that. I was expecting to see everything that they said Friday morning be backed up with our stuff that came to us today, and it didn't.
I just know last night when we talked, I said, are you sure you want to go to Plan C? And you said yes. And I said, because, no, wait a minute, let me finish. I said, I do not want to come and vote on something, number one, that we're going to be impugned about for here on out unless you're convinced and the ones that are coming on after us are convinced that this is the right decision to be made, because this board is going to make that decision. And you said, yes, we have support from the 3 that were elected, and we have a lot of support out of this board. And I said, okay, then all right, I'll come to the meeting and I'll be there in person. I just need a recommendation, because right now we're just going in circles. We're either going to make a recommendation, or a motion, or we just need to
I
stop
agree
the
with
discussion.
that, Barry. I 100%. I
Brian,
have had a lot of
Are we required to make a motion? We don't have to make a motion.
No, there's no requirement for a motion unless the board wants to take some action. A change would require a motion and a vote. Discussion.
So I just want to finish my comment. You're right, we did have that discussion. But here's the problem. Today, when I got the information, that doesn't look like what I expected. Carol and I were just talking about that. Those numbers don't look like what I thought I was going to see from Friday's conversation. We were on that call forever, and I kept thinking, okay, if everybody is recommending that we really have a big escalation problem in the school system, that's what we need to look at. I've asked a couple different times, and I know it's confusing, but we get that chart every day, 2 here, 3 there, 4 there, 10 there. Now it's down to this. That gets to be really confusing to go back and do the math yourself. Well, are we really adding numbers at an alarming, time frame? I don't know. That's why I asked, what do we have up to date now? Because I kept thinking, okay, with what we were presented on Friday morning, that's going to look really different from right now compared to whenever. That's not what came out. That's not what came out. 97 students when we were looking at November the 8th, and that looked like 300 and some. Now we've only got 97, and it's November the 24th. That's what I'm telling you. But I have a right to change my mind just like y'all do. And I'm sorry if you feel like you were pulled in here, misled. I'm not even sure what that is. I didn't like it that we had a called meeting back in July that changed a decision that we made either while I was on vacation.
In the meeting in July, we made those decisions. In fact, we asked Dr.
did.
I want to get to that one, because on July the 20th, Dr. Louder was the latest he could make a decision. And we asked him, all right, come to us with a decision. July 13th, we had a meeting, discussed all the different plans, and that's all we did. We walked out of that meeting waiting for him to come back with a decision, but he wanted to have some more time because he was hoping the rates were going to continue to go down. Instead, they went in the opposite direction, and then on July 20th or 21st or whatever but if you look at the meeting notes, they didn't have a lot of detail. But we made no decision because there was no motion made. The motion was made in the July 20th or whatever that was meeting, where I made the motion that we go into Plan C. That was the first and only motion that this board ever made going to Plan C. There was no confusion because Dr. Louder's team presented 3 different plans to us that night. He presented the Plan C, he presented the Plan B, in a number of different fashions for Plan B, and then he talked about Plan A, but at that point, the governor hadn't allowed us to go to Plan A, so it still wasn't an option. So that, I want to get that straight. We had no motion. We never agreed on anything in the July 13th meeting.
And I agree with you, but a board takes action in several different ways. We don't have to have a motion to take action. Not doing anything, the board took action. Recognizing we didn't have to take action also is action by our board.
But the board didn't make a decision, it didn't say what plan we were going in. We were waiting on a recommendation from Dr. Louder. So the board didn't take action because there was nothing to take action on. We were waiting on a recommendation, and we said, how long do you need? He said, I need a recommendation. I need to provide you something by no later than the 20th. And then I think we met on the 22nd or something. And that's when the actual real recommendation was made at that point, because we didn't know which way the numbers were going to go coming out of the July 4th holiday. And
Well, I'm not sure that's exactly how I remember, but that's okay. We'll say that we'll agree to disagree, and I get it. I did agree for this meeting to take place. I did feel like we needed to have a discussion about Plan C. There was a lot of stuff that came out with those phone calls on Thursday and Friday that really made things look a whole lot different. But this is what is so frustrating. You know, this is a huge decision. I didn't want to go into a December 7th or 14th meeting and give parents no time whatsoever to make that decision if we needed to do that. Looking at Friday's information and hearing all those numbers and thinking, oh my gosh, you know, we've really started making some changes here that's went up at an alarming rate. But that's really not the case for Cabarrus County Schools. That's the problem I'm having right now. And that's not anybody's fault. I'm not saying that's anybody's fault. We are all in a very bad place with making these decisions. You know, we're making decisions that people have never had to and probably
Ms.
wouldn't.
Furtenbaugh was also part of that letter or request for the meeting. Do you want to add anything?
Well, I did it because Holly was out of town. But I just want to share, first of all, I'd ask my colleagues to please put your mask on. People are noticing that you're here in this assembly without masks. This is not a scientific, I like to have scientific data, but this is not a scientific comment. It's simply from observation. In my retirement, I happen to be working in a grocery store a couple days a week. Over the last 3-4 weeks, the usage of masks has decreased significantly. Previously, families would not come to the grocery store. One parent, most likely, would come. Now we're seeing whole families come with no mask on. I believe part of the community spread is likely, again, not scientific, but likely from an observation standpoint, due to people feeling perhaps that schools are open, so therefore things are back to normal. We're going out and playing in our soccer leagues, we're doing things, having birthday parties with groups of folks, we're having all the cousins over to play, which all of those things are great and make it feel normal. But that in part is what is making these numbers go up. So we're still in a pandemic. We can't pretend we're not. So just regardless of what we do or don't do tonight, just really encourage folks, please wear your mask, keep your family washing their hands, try to stay in small groups with members of your household. There's no need to push the limits, because that's what's happening now. You get too comfortable and the numbers keep going up. It may not be you, but you may be a transporter. You just never had symptoms. You may have given it to somebody else. And in the very worst case, you're giving it to medical personnel who need to take care. You're giving it to a teacher, because we've had bus drivers, teachers, all sorts of employees in the district who have been diagnosed with COVID. Did they get it at school? Maybe yes, maybe no. It can't always be contact traced back perfectly. But don't be the cause of the spread just because you don't know anyone who has become sick. So.
Thank you. I guess the governor's added another executive order to strengthen the mask requirement, so that maybe that'll.
But there
help
is
them
one
walk
now.
into-
It's required to enter buildings, and people don't do it. Having close conversations with people they know in the grocery store. I play dodge and weave when I'm working. If I see an assembly of people, I don't go down that aisle.
Okay.
But everybody needs to try to be that careful.
Question, is there any other school systems in this area that have gone to Plan C from Plan B that you're aware of?
Not that I'm aware of.
And with that, I guess we either need to make a motion or we need to make a motion to adjourn our meeting, so.
Mr. Chairman,
Yes, Ms. Carpenter.
one thing I was wondering, now, are we going to do any testing this, like in January, like we normally do, or will there be no testing in January of this year?
So the state has said that testing will all be the same and has to be done in person. So right now, we would have to have a plan to bring students in to test them in person for EOCs and CTE classes, which are the state tests.
So, I mean, if we would do something, then that would not work. If we would go to Plan C, then we would have to do something then.
If we went to Plan C, we would have to make accommodations for people to come in and test and then go back home.
Okay. So
Because that's not negotiable at this point. Whether it would change is that you have to come and they're going to hold you to the 95% test rate.
when are the test dates? What is the test dates?
The EOCs are somewhere in the middle of January, and some of the CTE tests and some things that would have to be given would actually be in December.
Okay.
So, but again, we're talking about a fairly small amount of students depending on, how they would come in. So we would have to have a plan to bring them in to test because it's required by the state.
And one thing that she did mention, she says she did mention that the school system was doing an excellent job, but Holly, she did mention she said she could not say 100% that it was not carried by the school, the schools were not carriers of it unless they did other type of testing. Do you not remember her saying that?
I did, but here, I guess we go back again to, that's why I asked for the information that we got today. So if our numbers are so much lower than what was given to us about the overall county that included the schools, that you have to really know to break that down to private schools, charter schools, homeschoolers. I didn't think about that piece of it. I'll be honest with you, Barry, you're frustrated that we're here tonight. Well, I don't know why we were having those conversations on Thursday and Friday if there wasn't supposed to be a recommendation that the Health Alliance was wanting us to move to Plan C. So that's where I'm totally confused.
The Health Alliance was all about getting us the information so we could make a decision. I didn't detect anything out of those meetings that there was, and if the 4 people that were coming back were not willing to have meetings to talk about this, then I didn't want to have a meeting. Now, if Rob and you and Laura, if y'all came up and said, we want to have a meeting to talk about this because this is the 11th hour for this board to be convening, I just didn't want to be a part of an 11th hour decision unless there was truly conviction on the part of the people that were going to be here to live with the result of the decision, whatever it might have been, unless there was conviction from them. The health department only came and elevated to us to say, here's where you are on this chart. two components are in the red and one component's in the orange, and you see that orange is saying Plan B or Plan C. The red is definitely saying Plan C. When you get above 10%, you really need to really start considering that your area has got 1 out of 10 and possibly is going to rise at a much faster rate than that. We know that in a lot of places around us, Gastonia is already in the red, that other counties are doing it. They were just trying to give us a sober viewpoint before we went into the Thanksgiving holidays and before we went to the Christmas holidays of where we were going to be, and to make sure we were aware, so if we wanted to make a decision, we could. And that was what I looked at that conversation. It was not compelling us to make a decision. It was trying to give us the information we needed to make a decision. And they weren't blaming it on the schools in any way or form. They were just saying that, guess what? People are not behaving, they're not they're not wearing their mask, and they're getting themselves infected in whatever way they are, and they're finding lots of ways of doing it. And we're coming into the norovirus season, we're coming into the flu season, and flu is on the uptick. And so, you've got all these other things that are getting ready to happen, and they were saying, we're just concerned that you're getting into infection time. And that was the reason for the meeting, to make sure that we were aware of what we were getting ready to go into, so we would have opened eyes. And I didn't detect any movement, so I didn't, say anything this weekend, because until I heard from the people that were coming back, I felt like it was up to them. The ball was in their court to say, all right, this is what we want to do, because we feel like so convicted that we have to do this. But I did not want the three who were going off the board to be the bedrock of the decision that puts us into Plan C, because that would have been unfair for the new board and for the parents and children of Cabarrus County.
Thank you. My perspective, though, was that it was a recommendation, and they did want us to act before Thanksgiving. I remember them talking about the effects that Thanksgiving would have and how it would be a good idea to do the action sooner rather than later. That's why we're
right. But you never made a recommendation for the board to meet or anything else, and neither did I, neither did Cindy, and neither did none of us made any recommendations. So we were quiet.
I was certainly willing to wait till the new board took a look, see those numbers.
So, Mr. Chairman, I think that we have hashed this out. We've kind of gone in circles in many ways. I am going to make a motion that we adjourn. Can I get a second?
Second.
Okay, so we have a motion and a second for an adjournment.
One quick question.
Discussion.
I'm just gonna put my last 2 cents worth in. My biggest fear is we're going to see these numbers, double digits, even go up, and I'm afraid that it will affect, so many people want to see our sports come into effect, and I think you can pretty much, probably, it's going to put a damper on that, because it's going to keep, soaring, and I see that becoming a real problem. And so that's my 2 cents, because I think that's going to happen.
Okay, Mr. Harrison, discussion.
If we are in a discussion mode of the motion and the second.
There's a motion and a second to adjourn, and we're in discussion at the moment for that, before we vote. So if you have any last comments, please feel free to add.
My contribution to the discussion is that to adjourn with data that is going as badly as it is countywide is an act of cowardice. Thank you, Mr. Chairman.
Thank you, Mr. Harrison. Any further discussion on the motion? Okay, all in favor?
Mr. Chairman, I'll just say I'm disappointed, because I felt like you were so concerned, and you wanted us to have this discussion, that it was time.
Cindy, I'm not disagreeing with that. I was concerned. We had a meeting last Monday night. The superintendent said he did not have a recommendation at that time. And that's pretty much what you said in the meeting. And that's, that was fine. I heard that, and that's what you said. And I felt like we walked away with that mindset. No recommendation this time to do anything different. Board members stated they didn't want to be a part of doing anything different. Barry, you said unless there's 4 here that'll agree to do something different, I don't think it's a conversation worth having. That was pretty much what you said. Hang on, Cindy. And I got that, and I thought, okay, so we're moving away from there. Then I get an email on Thursday that says, Cabarrus Health Alliance is concerned. Y'all need to be looking at some of these numbers to maybe possibly do something different, to move into Plan C. The Thanksgiving holiday is going to be a problem. That came from the superintendent, who just said on Monday, we didn't have a recommendation. I didn't understand why we were going to do those telephone conference calls, go over this new information, if the expectation was not to do something about that. And I said, I agree, those numbers were alarming. There was a lot of stuff going on. It was a moving target. We did need to have the conversation. If I was hearing that we are having critical numbers of teachers being quarantined, that we're having trouble covering classes. You know, there was a whole gamut of things that it was going to tether over into the school system because of us being the largest number. You know, there was a lot of stuff. I was more than happy to be open-minded enough to move into Plan C if we felt like we have no staff to cover, and that's a critical thing. I had not heard that. You know, if the numbers were at 300 and 400 in students, and I thought, if I'm not paying attention, but I'm not putting those graphs together that we're doing this at more of an alarming rate than we were. But we're not. We got it today, and it was only 97. That was very confusing for me. I'm sorry that y'all got it that way. If you feel like this is my fault, I guess I misinterpreted the whole reason of why we were having those telephone conference calls.
Well,
Okay.
I have something to say.
Let's try to make it short.
I'll make it as long as I want to, okay? This was what I was afraid was going to happen. We're going to show up, we're going to have a conversation, and it was going to be continued to be exactly the way it was last week, the week before, and the 4-3 kind of thing. I didn't want to entertain that because I knew that that was what was going on. Last night, you assured me that this is where you wanted to be. So I came because I thought that's what you wanted. I even helped make sure that Rob knew we needed to have this emergency meeting because 2 board members, you and Cindy, had asked, and Cindy done it at your behest, to have this emergency board meeting. Believe me, we had talked about it, but we said, no, there's no way that we would have an emergency board meeting unless the people involved, who are the 4 that have always voted differently than the 3 of us that are going off the board, unless they were going to actually want to make a change and see the numbers for what they were. We didn't get that. And now you said we were going to have that, so we come to have this a meeting, and I feel like we've gone into the circles. We've gotten, that's the only thing we've done is talked about the Health Alliance, and Rob, you said they made a recommendation. They said, look at the chart, and look at the chart for what it is. You've got 2 out of 3, and you've gone up 2% in 1 week. That's pretty high.
Comment
we
was
went-
it was
wait a minute,
gonna
you
be
stop. I have got the floor, leave it alone. This is my last meeting, so I'll take my liberties.
Looks like you were.
So we got hoisted down here to turn around and adjourn, and I've wasted an hour and a half of my time. So let's adjourn. I'm ready to vote.
But Barry, what is the problem with us
Okay,
having the
anybody
meeting
else?
that we?
Ms. Furtenbaugh. Ms. Furtenbaugh.
I want to share, and I'm not going to name who this was, but I have received emails from several principals during the course of this meeting who are watching the meeting. One comment was, we are having to pull people every day to cover classes. I'm guessing that means out of planning time or if they have downtime or whatever, because subs are not picking up the openings. So principals are managing however they need to manage. The other thing that we didn't discuss tonight was how many more students have been pulled out to be fully virtual because the parents see those numbers rising, and we're having diminishing returns for having that staff do dual teaching, everything else that has to go on to prepare for all those students. So I don't know, last week or so, Dr. Lauder, you shared it, we were down to like 62% who were attending. It's apparently is continuing to happen?
Yeah, it's not massive numbers, but yes, it's roughly 62%. It may be 61, but that's about right.
What you sent out today was 63.4 is still attending in person.
That was from when you requested it the last time, so there has been some movement since the last time because we
That
would have
just
had.
came today.
Yeah, that was you asked for the same thing that you asked for a week or so ago, so we gave you that same information. Otherwise, we would have had to what we explained at the time is we would have had to poll every school to see how many kids went from B to C since Friday, for example, so.
That's important to know. So you mean we don't know?
Okay, do we need to go back?
I don't know.
into this
This is
discussion?
frustrating to me because
'Cause
I'm
we do have a
hearing-
motion to, and a second to adjourn.
I want to make sure I say what I say. So I asked you for the information today, and my email said, I need updated information as of today. So my thought would be. if
Hang on,
you-
I want to make sure I see exactly what the
And
email
it
said.
is on the email, I'm reading straight from it for today. And I
It
said,
sounds like we don't need to adjourn right now. If we're still having,
well,
this-
evidently not.
okay, so
So
is there a
let's,
consensus here? We want to
we're
continue
in
these discussions?
discussion, correct, Rob? That's the
We're
part
in
of the
discussion on
procedure.
adjournment, not a discussion on, back on the agenda item that we just left.
Mr. Chairman, cancel the motion. If we are not going to act on the motion, then cancel the motion and let us move on and continue.
Mr. Shaw can-
And to open off the floor.
Thank
Yeah,
you. Mr. Shaw.
I would say that we should have discussion at this point only on the motion to adjourn, unless the motion to adjourn is withdrawn. So you have a vote on it,
Will you withdraw your motion, please?
and there may well be a desire, I'm not trying to adjourn it, but I think discussion should be limited to the motion on the floor.
Do you want to withdraw your motion?
No, I don't want to withdraw my motion. However, out of respect for the rest of you, I will, so that we can continue to go over and over in circles again. So I will withdraw my motion.
Okay. Motion's been withdrawn. Back
And
to,
and I'll just tell you, I normally do not watch emails during the meeting. Just received another email that a team at one particular school has had to cover teammates' classes for over 2.5 weeks straight because because of the substitute situation. And Dr. Latter, the one, I just forwarded you one comment there, that the high schools have even lower, that they're closer to 50% attendance.
Yeah, I think in the document that we sent you is to show you that, so if the district is at roughly 62%, high schools are much closer to 50%, elementary is probably closer to 70%, and middle school is somewhere in the middle. So that's, the older the students get, the more likely they are to have been all remote. And that's been the case since we went into B.
Mr. Chairman,
Mr. Harrison.
I think it is appropriate at this moment, we have a motion, and a second on some motion, and then a discussion on that motion, so that we can proceed and not spend another hour, hour and a half in discussions for which there was no motion. May we please have a motion and go forward in the discussion of that motion. We've spent a great deal of time here. It is incredibly astounding to me that we are not focusing on children's health and the well-being of the staff who have to monitor and be there responsible for the safety and the health and the education of the children. May we please have a motion and proceed to discuss the motion.
Do you want to make the motion?
I do not, sir, no. I did not call this meeting, and I'm here hoping to establish some credibility, which is rapidly evaporating
Blackwell.
with this board.
I will make a motion that we continue in Plan B.
We don't need a motion for that.
Well, I mean,
That's what it is.
if this is the discussion that we're having,
Okay,
and
so
we need
there's-
to make a motion in order to continue discussing it,
There's a motion. Do we have a second?
Second, and then you can open the floor for discussion.
Okay. We are now open for discussion. Did you get your question answered?
No, I did not. So that's my whole point. So when you sent that, this is the whole point. I just asked earlier in the meeting, are we running into any type of critical situations or real problems covering staff for whatever reason? Quarantine, they're not
you-
there. You're reading emails that says to me contrary to what I just asked the superintendent in the very beginning.
No, ma'am, what I said was, or would I consider that what we're at now critical for us to be able to not be able to operate? And I said I do not. But I also said it gets worse every day. So the more that we have spread in our community, which is part of the reason that the Health Alliance brought this information forward, even though it is not being transmitted at school, the more that there is in the community, the more likely that someone's husband, child, daycare, or some other place will quarantine them, so it will continue to be more difficult to cover classes as the community spread continues to be significant. So even though they are not getting into school, the community part of that does begin to put a tax on the schools. And as I said earlier, we may have one school today that has 10 teachers out. Tomorrow, that school could only have one. So it happens in pockets depending on how many cases they have and how many quarantines they have, which is very significant depending on the situation in the school.
So I'm right back to why I thought it was important to have the conversation tonight, because we heard that information. You said the Health Alliance was recommending that we move back into Plan C. I don't know how we do anything. I don't know how we take any action from the information that we were told that we needed to be a part of on Thursday and Friday, after we already had the meeting on Monday, and it wasn't your recommendation to do anything else, but now on Thursday and Friday, we're needing to be a part of conversations that says we probably need to be looking at that. We don't have another meeting until December the 14th, or the 7th and the 14th, which would give parents no time whatsoever to react. And what I'm hearing from you is we do have some very serious situations about covering staff. How are we supposed to make a decision when this is all over the place? What I felt was very important to have a meeting this evening, I'm right back to where we're at because of what I heard on Thursday and Friday that we didn't hear this past Monday. That was not your recommendation then. But all of a sudden, we need to look at different information on Thursday and Friday. We've got to have a called meeting. That's the only way to take any type of action. If you defer it to the next board meeting for the next board, that gives no time whatsoever to do anything with parents, and they're only in school for another week. So I felt like if we needed to take action or that needed to change, now is the time we have to do it. That's my position. But the numbers that we got today, after I got clarification, don't really back up the numbers, or it's a piece that was not pulled out for Cabarrus County Schools from what we've received on whatever session you chose to attend on Thursday and Friday.
Okay.
That's where I am.
Thank you. Ms. Furtenbaugh?
I would just say, since I advertised that I was looking at email tonight, they are flooding in. I had to silence things because it was vibrating and going crazy over here. But middle schools and high schools are getting a lot of comments, are consistently saying they're at or below 50% in person. Northwest Cabarrus High School today, let me find the number. I just sent that to you, Dr. Louder, too. What was that number? They had 100 and... So a high school that has about 1,200 kids enrolled. I'm sorry, let me find it here again. They are down to, I'm going to have to search here, sorry. That's how fast the emails are coming in.
I'll come back to you.
They were down to 138 students in person today because everyone has the ability to do the synchronous learning by just staying home that day. Either they feel bad, they're worried, whatever the case. So honestly, I don't think, we're not even operating a full Plan B right now because people are withdrawing, not from school, but withdrawing from Plan B.
But where are we with staff is what I wanted to know, because that was the piece that we didn't really have a good picture of. Are we truly in a bad situation with staff that's having to stay home, be quarantined, can't cover the classrooms? That was the piece of it that
I'm having multiple principals reply, and maybe I should have just done an open Survey Monkey earlier today. Just had a high school teacher report that his whole class has gone virtual for one of his sessions. He doesn't have anybody in the classroom.
Well, good, then we can use him to sub.
What's that?
We can use him to sub for other classes then.
No, he still has to teach. He's just teaching virtual. That people are having to quarantine because a family member.
Okay.
And they can't be at school. Folks, I don't think this is a rosy Plan B that we maybe thought it was.
Okay, so that's the point, isn't it?
Huh?
That was your point? It's not a rosy Plan B?
Yeah, I think we need to be sitting back here and considering what we came here to do tonight.
But I'm still back at, Dr. Louder, my question to you is, last Monday, you said your recommendation was not to do anything different. Where are you now? Because that seemed to have changed somewhat with what the Health Alliance was telling you for Thursday and Friday. Where are you now? You are the one that needs to tell us what is your, you are the one that sees the pictures of all those.
All right, so I'll say again, what happened last week was there was, and certainly what I think was apparent in the meeting and what we were told was that there were, all the kind of word on the street was that we might go into Plan C at last week's meeting. And it was very clear that we have a new board that's coming in, and while a majority may vote for it now, it didn't appear that the new board supported that, and that several of you guys didn't support it either. And so what we said was it will be, in my mind, would be much more disruptive for this board to put us in C, and then a week later of school to put us back in B, and some board members and future board members are putting out in the public that they're going to put people in A. So if we were in C and the board in 1 week we're in C, the next week we're in A, we're back in B, I think that would be a terrible thing for the school system, a terrible thing for students, and a terrible thing for staff. So this board made it clear last week that they didn't think, even though there may be a majority, that that would be the right decision. They would leave it to the next board. And I think it seemed like the room agreed with that. As you can see, probably the nation has had a bad move in the direction. The state has had a bad move in the wrong direction, and the county has had a bad move in the wrong direction. The Health Alliance met with us on Thursday with both school systems, like they always do, and essentially said the data is really dire in Cabarrus County, just like it is in the state. And so we would like to communicate that. So Dr. Buckle and I set it up for board members from both boards to have the opportunity in 3 different sessions to meet with the Health Alliance, hear their information, see this chart that's on the wall in front of you, be able to ask them questions. And most of the board did that. When that was done, there was no indication from any board member through the sessions, because I was in the sessions with our board members, that they agreed with the Health Alliance. I don't believe you agreed with the Health Alliance that we should move to C. I don't believe anybody here that attended, except Ms. Carpenter kind of made it clear that she thought that maybe we should do something different. I would agree. But other board members either didn't or said, you know what, I don't think we should make that move now. We should wait for the next board. And so that's what it seemed like on Friday when all the sessions were there. You didn't indicate at all that you thought we should meet, talk about it, talk about personnel, no questions about personnel, didn't hear a thing about that. So I assumed that we were then moving to wait for the new board to come in and make a decision. Yesterday, by the board chair, the board vice chair, and other board members said, and then you called me last night to say that we wanted to have a meeting today because you wanted to go to Plan C, and other board members supported it, including future ones. So I was prepared tonight to try to answer questions and be set up. Let me make it clear that I will always agree with the Cabarrus Health Alliance. They are the health professionals. They are the people who know and understand virus, disease, public health, and when they say that they are concerned and we should be concerned as a school system, then I'm always going to say, I believe we should lead with the Health Alliance, because again, they are the health professionals and they have been tremendous to work with in this setting. So I will always say, when the Health Alliance says we should be concerned, we should be concerned. So I would agree with the Health Alliance anytime that they're asking. But at no point on Friday or yesterday, when you and I talked on the phone for 40 minutes last night, did you ever say, I want you to indicate this? Or no board member did. They said, Ms. Grimsley is requesting this meeting to go to C, and Ms. Furtenbaugh is kind of requesting before because she's out of town. We're going to have a meeting, and everybody's going to go to C. So I assumed that would happen, tried to get you all the information that you asked for, and came to the meeting tonight assuming that you guys were going to go to Plan C because nothing had changed without that. So I don't know what else I can say there, except all along we've told you what we were going to do. We've tried to answer any question that you have. The board at one point said, Dr. Louder, we'll let you decide whether we're in A, B, and C. And then the board very quickly said, you know what, we don't want you to decide that anymore. We're going to decide. And so I have no problem saying that I agree with the Health Alliance, will always agree with the Health Alliance, because I trust them and respect them. And so I am concerned, just like they are concerned, but my understanding is the board has to make the decision. And until yesterday, all indications were the decision would be B. And yesterday I was told it was probably going to go to C, and we needed to have a board meeting, and that's why we're here.
Well, I'm going to again say, we don't make decisions on telephone conference calls. I would have never even thought that that's what we were doing. We ask questions. I don't think anybody was asked during those conferences. If you were, I was not a part of that. Are you going to, do you want to go to Plan C? Are you entertaining that? There was no discussion there about that. I assumed that that was the reason we were getting the information, was to entertain whether that was a decision that we would need to make differently. You're the one that said that that was the reason why we were hearing the information, was to have a discussion about returning to Plan C, or otherwise I don't know why we were even having the information. So I guess we're all going to have to agree to disagree. I apologize if that's exactly, if this whole called meeting is my fault, then I guess it is where it is. I think we needed to be here to have the full discussion, to get the numbers out there so that people understand what we're looking at, what we're using to determine the numbers and decisions that we make, whether we keep them in B, put them in C. I felt like it was very important. Everything that came out of there Friday morning was concerning to me. We get lots and lots of information. I said, yes, I would like to have a conversation about going to Plan C. I'm assuming when we say that, that's the whole reason we were asked to do what we were asked to do on Thursday and Friday. So with that being said, with the information that you gave me today, and I'm hearing you don't have a recommendation to go to Plan C. That evidently that's what you're saying, that you don't
just
have.
said you supported the Health Alliance's recommendation.
But what is it? Y'all just said they didn't make a recommendation. Which one is
says
it?
recommendation
That's
right on
what
the
I
screen.
said. Barry said they didn't make a recommendation. I thought they did too, but I thought maybe I missed that somewhere. But that's what I'm asking you. If that reasoning for having those telephone conference calls were to discuss about having a meeting to go to Plan C, which we would have to do as a board because it is our board, our decision, that's what I assumed. I was out of town this weekend. I was assuming that was what I was needing to do, was to make that decision if I was going to be a part of that decision to move to Plan C. That's why I did and said what I said. That looked differently to me when I started seeing our numbers today that you gave me today. I just sent you that email today, so my
No, but
thought
I
is-
have to say that because you've said before, I send you every day all of our positive students
I know.
and all of our positive staff, and it's updated every week on the on our website. So that information has been there since we started.
It is, but what I was telling you is when we get a bunch of emails like that, it might be easy for all of y'all, but I work, and so I'm trying to go through those things, and I'm getting 2 here and 3 there and 10 here and 5 there every other weekend or every other week or every Wednesday or whatever that day is. So it's really hard for me to go back and try to picture in my mind, where are we truly up to? If we were getting, okay, and this is what I've asked, and maybe that wasn't clear, when we get the 2s and the 3s and the 1s and the 7s, I would love to see that number updated, that we're at this number now. Like today, that's the first time I've seen it, that we were actually at 97 students and 40 staff. And I thought, well, that looks a whole lot differently compared to what we were looking at Friday morning, but evidently that number did not just include Cabarrus County Schools, it included all children through Cabarrus County. That I don't think was identified on Friday morning, so that did look different to me. There's a couple of different things. But what I'm still saying is, I was hearing you say that you backed the Health Alliance. They were asking that we look at moving into Plan C. I thought we needed a called meeting for that because we have to make a decision, and that's the only way we can do it. So that's why we're here. If that all got skewed, my apologies. I just knew I needed better information to be able to make that decision. I was willing to be open-minded about all of it if that's what we need to do. If we're having a shortage in staff, and I'm hearing you say we do have problems, but I need to hear that from you because you are the superintendent, and it does need to come down from you.
Yeah, Mrs.
All
Grimsley,
right.
I'm just a suggestion. Your original idea, when you called me yesterday morning, was to only go to C until January 3rd. January 4th is the first day back. If you want to make that motion, I will support you in that, as I told you previously.
I will not
That
make that motion now
It will only be for
because
3 weeks.
I said the only reason I would entertain that is if the information that we got Thursday and Friday really balanced that we've got some critical areas in what we were getting on Thursday and Friday. That,
The
I
motion
was,
on the table is staying in Plan B.
okay, well, I
Yeah,
will
but we don't
second that
have to
motion.
make a motion for that. We do nothing.
Oh, we have,
And it
but-
stays Plan B.
That's our discussion.
So I'm just saying, this is, I'm astounded at the information I'm receiving here with how many kids have gone remote. And one person made a good point, is that if a child is quarantined because of whatever other circumstance, they are then moved to full virtual, and they're not counted in any numbers potentially. So if they go into quarantine, and that's a high volume, let me just tell
So,
you.
Dr. Latta, that was one of my questions, I don't know back when. I asked, how do we identify those that are in quarantine? That's what's frustrating about this.
And I've answered, we identify the quarantines, and then the Health Alliance helps us to determine who has to be quarantined, and then they must follow the guidelines that the health department establishes.
And I get the definition
Mr.
of the
Shaw, do you have-
process, but
you have
where are we at with that? Are these 97 and 40s? Is that, how do we look at okay, how does that 97 and 40 impact our whole school system? Where, I'm hearing you say that you're getting eat up with emails that saying, yes, we are having staffing issues. I'm hearing Dr. Louder say that we're not. Which way is it?
No, I'll repeat what I said before. You asked me, are we critical so much that we can't
Well,
operate?
let's take critical out of it. Let's just take that, if that was the word that causes the issues, let's take it. Are we headed into problems of having teachers cover classrooms and not enough subs, and we're going to be in problems of having teachers, period, just period?
And as I've answered before, that began literally on the very first day that we started in October, and it continues to get worse as there is more community spread, which
what does
we are
that
now
mean?
at the height of community spread.
But what does that mean? We are in serious trouble with having teachers cover classrooms, or we're not? We're sustaining, maintaining, there's enough subs to cover it, we're okay? What does that really mean?
And I said that it depends on the school and the situation. So right now, we could have a fully staffed school, and tomorrow, 2, 3, 4 teachers can come in and say, my husband was positive, I have to quarantine. My child's daycare is closed, I have to stay home. And so tomorrow, or not tomorrow, next Monday, we could have 10 teachers, 12 teachers at one school that may have to quarantine. Some of them only have to quarantine for 48 hours, depending on their contact and the situation, or a positive test, and sometimes as many as 24 or 28-day quarantines. So you can go from, you know what, my school, we haven't had but 2 situations and don't have a problem, and in one day can have a massive staffing problem because of stuff that happens over Thanksgiving, for example, which is why a lot of this was put on the table, is to say, if we go out all over the country and bring that back, then we may have significant issues. And so the Health Alliance was putting that forward to saying, our numbers are huge, and so we said, well then let's try to get you all the information and let you guys ask questions, which is why we set those meetings up.
Okay, and which brings me back to why we're here tonight, but I'm hearing you say you don't feel a real threat that we are in a bad situation with teachers and covering classrooms for students.
I'm saying that we operated today, it wasn't critical, which is the word that you asked, but we could on Monday have a number of schools that could be, and as a general rule, that gets worse every day. And so when you say community spread doesn't affect schools, we are the largest employer in Cabarrus County with 4,500 employees. Then all of them, when you take a certain percent that again are affected, sometimes they have nothing, often, I would actually say the majority of the time has nothing to do with school, then that becomes a problem immediately. So a principal may email Ms. Furtenbaugh or call one of us tomorrow and say, I've got 9 vacancies today. And it all may be because of, again, childcare issues. To be honest with you, that's one of the number one problems is that the parent has to quarantine because of a daycare has closed or they've been exposed to a child in daycare. Those are things that we can't control. We can't track the cases because they are children, they're not our employees. And so, but we have to react to it, and the principal has to cover the school.
Right.
But that's happening all over the state of North Carolina and all over the country, I assume, as cases begin to increase.
Then that makes me feel better, because I'm hearing that you're reacting to it, but we evidently are handling it.
Correct.
We have handled it through today, yes, ma'am.
Right.
Mr. Harrison, do you have any comments on the motion?
I wish we would call the motion.
Not yet.
Certainly, exhaustively.
Okay, everyone's going to have an opportunity. Mr. Shoemaker? Ms. Carpenter? Do you have a comment on the motion that's before us now? Just stay in B.
I don't think we have, I would rather have a recommendation from our superintendent. And I don't think we have enough data, and I would rather wait till we get the data from the Health Alliance tomorrow and have a complete, because I have feel sure that we're going to be turning red and that we're going to be well over 10%.
Okay.
I think we're just asking for trouble.
Okay.
So I don't think we have enough data.
We have two other folks on the line, our teacher representative and our board intern. I'd like to get their perspectives. So, Emily, are you on the line with us? You want to?
Yes, I'm not really prepared to share or give my perspective at this time. I apologize.
Okay. Finley Edwards, you're a student at Cox Mill.
Yes. First of all, this meeting, wow. Secondly, my perspective as a student who is currently in the Plan B rotation and doing the face-to-face learning 2 days a week, I can testify for myself that being in person is extremely beneficial to those who have chosen to come, because students are more productive, many have improved their grades, and we are able to socially interact with our peers. We're also able to form relationships with our teachers and have communication with them in person rather than through a screen, which is extremely difficult. And from my experience in school, all guidelines and safety protocols are being followed to a T, and everything has been doing great, and I have never felt unsafe in regards to my health. As a student, when we are constantly switching plans and have inconsistent schedules, it takes a toll on our well-being and causes overwhelming stress and anxiety. And the families who do feel unsafe have that choice to remain virtual and drop to virtual if they do not like the in-person learning. But those of us who thrive in an in-person environment should not be forced into a virtual platform that only makes learning harder. And if the spread of COVID is not coming from clusters in schools, then why would we even consider going to a 100% remote platform? There are only 3 weeks after Thanksgiving until winter break, and this means that those who are in person are only going to school 6 days within those 3 weeks. With the governor already tightening restrictions on masks and gatherings beginning tomorrow, I think we should see what the new data may bring before jumping backwards to move to a Plan C for schools.
Thank you for the comments.
Can I make a comment and just say that I absolutely adore our intern? Thank you.
Okay, so we've had our discussion on this motion. So we have a motion, a second discussion. Let's vote on it. And the motion was to remain in Plan B. All in favor of that, please say aye.
Aye.
Aye. Okay, those opposed say no.
Mr. Chairman,
Yes.
could you, since it's not a unanimous vote, could we identify who is voting yes and no
Okay, I
so
think
that our audience can tell?
That is a good idea. So it's Ms. Blackwell, Ms. Grimsley, and myself have voted yes. I didn't hear any other yeses. Okay, those opposed say no. Cindy is a,
No, but this is like a reverse
it is.
motion.
Okay, Ms.
not voting.
Okay.
Because I know that means it's a yes vote, but I'm not voting.
And Mr. Harrison?
I'm sorry, did the other individuals not vote?
That's correct. Barry Shoemaker abstained.
And I really prefer not to vote because it's just a reverse motion on why we came here tonight, so.
The motion is, I'm also abstaining.
Okay, so are you abstaining, Ms. Furtenbaugh? Or is that a no?
Yes, because I don't know why there doesn't need to be a motion to stay in Plan B.
Okay. So the motion that was on the table has passed.
That's correct.
With Ms. Carpenter opposed.
I'd like to make a motion that we adjourn.
Second.
Okay, a motion by Mr. Shoemaker, a second by Ms. Blackwell. We've already had our discussion, so all in favor of adjournment, please say aye.
Aye.
Anybody opposed? Okay, this meeting is adjourned. Thank you.